what are the common complications? How many trips does it normally take? Are there any lifestyle restrictions?
We asked 20 such questions to Bangkok's top hair surgeon, so you make the right investment for such results.
My name is Julene De Vera, and I'm the Customer Delight Manager here at Medical Tourism Corporation. Introduce yourself, like your full name, specialization, your years of experience.
Okay, I'm Dr. Ming Papon Asawawalalit, a board-certified hair transplant surgeon specializing in FUT, FUE, and corrective hair restoration. I've been practicing for over 10 years in this path and was certified by the American Board of Hair Restoration Surgery, or ABHRS, which upholds the most rigorous global standards. In addition to being ABHRS certified, I'm a full member of the International Society of Hair Restoration Surgery, or ISHRS, the largest society of this field in the world. I'm the primary person answering patients' questions both before and after hair transplantation, including provide consultation to patients via video call. And I also produce education articles on hair transplantation and hair science for publication in our clinics media.
One of the main reasons why our patients seek medical treatment overseas is because of the price. That's really their main reason. Why do you think hair transplant procedures is really affordable in your country compared to others like US, UK, or Australia?
The affordabilities come from systemic factors: lower overhead, lower cost of living, and government support for medical tourism. Importantly, affordability does not mean compromise. We focus on quality control and every step during hair transplantation, so we can get great quality hair graft with a very good growth rate.
If you can share with us again what mode of payments you accept, and if it's cash, like what currencies?
We accept most of the credit card.
And if it's for cash, is it only, I
Yeah.
believe, Thai baht?
Oh,
Or do you also
Uh,
accept dollars?
we can accept on Thai baht, dollars, or euro. It's okay.
If you can share with us now why your clinic stands out for all other hair transplant clinics in Bangkok.
Technology of the clinic is the great standard of the international standard for hair transplantation. Our price is the net price, no additional price, and we mainly add the great quality of hair graft, less trauma of the hair graft, the good quality of hair graft that bring the patients the good result. The private surgical room, and we accept only one case per day. We have partnership with the 4 or 5-star hotels, and we provide custom meal plan and recovery kit, and we will give him PRP and PRF as the comprehensive.
It's very generous, Dr. Ming. If someone asks you, Dr. Ming, what is hair transplant and how does it work? How do you share it with them?
The hair transplantation is the science can bring you the fullness of the hair, and we will harvest the hair from the back with FUE or FUT technique to relocation of the hair graft into the front or into the crown that patients want.
Is the process painful?
Minimal pain, especially when we put the local anesthesia. That's all.
Okay, that will help at least to
Yeah.
alleviate the pain. How many trips does it normally take for them to finish the process? Is it only going to take one trip or mostly 2 trips, or how many?
Actually, one trip is okay. After that, we can advise him to do something, such as remove the scalp. They can do themselves. And then after that, can follow up via the pictures, the photos that the patient sent to me.
Also, how do you normally determine the number of grafts a patient needs? Is there a process that you follow?
They can send us the pictures, the photo first, and then I will estimate the area, approximate the number of hair grafts, and also the price. And then they can choose which number of hair grafts they want to transplant, and that's the net price for it.
If you can share with us also the step-by-step process. So you mentioned if, let's say, I'm the patient, I have to provide my photos.
Yeah.
And then you will, of course, again determine how many grafts I should need.
Uh,
The next step would be, I believe, consultation. Or if you can tell us like the step-by-step process.
Before the surgery, I will make the appointment for the video consultation with the patients first, and then book the appointment. And then at the date of surgery, we will do the surgery. And the next day, I will advise them to clean their head first. And we will advise for how to deal with, how to wash their head. And then about if they do with the FUT technique, I will appoint about 1 week to stitch off. And then about 2 weeks, if they were available here, I will appoint for clean the scalp.
Are there any lifestyle restrictions that they need to follow post-procedure? I believe, of course, they have to take care of that part. What are the things that they should do and they should not do, like after the procedure?
They should avoid scratch or touch in the area that they had to be transplanted for 2 weeks. This is the main point here.
So avoid touching for 2 weeks.
And if the patients do in the front area, they may have swelling in this part about 1 week.
Oh, so that's normal. Like that will go
that's
away
normal.
after. Okay. So they don't have to worry if it. Okay.
No need to be worried. No need to do anything.
Okay, perfect. So that's a good thing. At least they should expect that that's a normal reaction. What is FUE and how does it work?
FUE, we will use the little hair punch to penetrate and then remove the hair graft one by one. Use the small punch and remove one by one. And then we will prepare the hair graft and then we will place in the recipient area. And about FUT, we will harvest the hair graft in the strip like this. The depth of the FUE and FUT technique, the depth is equal. And then in FUT, we will remove this hair strip here, and then we will divide into each hair graft before we place in the recipient area.
You mentioned that based on the photos, you can already determine how many grafts you'd need. But is there a criteria how you pick patients if they are a good candidate or not a good candidate for FUE or FUT? Like how do you see like, oh, this can't be a good patient for hair transplant?
If he don't have a good quality or good density, the back he or they is not a good candidate for hair transplantation, because we will harvest the hair from the back first. And then in patients that have large area that he want to be transplanted, he need to use many hair grafts. So FUT technique is more suitable for him because FUT can bring more hair grafts.
How about other conditions, like maybe health related? Do you also check those, like, oh, this is diabetic or this is something like with heart disease, they're not a good candidate? Do you also check that part?
Yeah, I will ask him first that he have any underlying disease or take medications, which medication that they should stop before coming.
Perfect. So again, a patient should be healthy for him to do this. Okay, perfect.
Or if he have the underlying disease but that he can control, that's okay.
I believe FUE and FUT is just different processes, but how long does a patient normally see results for FUE and for FUT? Is it the same or is it different?
Yeah, the same. About the fully result is about 9 to 12 months after surgery, the long process.
Now, Doc, I know, of course, that you will do everything in your power to avoid risk and complication, but if you can also educate again our audience, what are the common complications of FUE or FUT and how do you resolve them or manage them?
The main complication of FUE is over harvest. For me, that I can do in both technique. So I advise to do FUE not more than 2,500 hair grafts, because if you do 3,000 or more than that, the patient's density in the back will be less than normal. That's why FUE can cause over harvest in the donor area. But complication in the other part is the hair graft didn't grow like that, or the direction of hair graft is not the natural.
I see. Yeah, that makes sense. Now, you mentioned, Doc, that it would take 2 weeks for them not to touch the area where the
Mhm.
hair transplant was done. Um, let's say a patient makes a mistake and he
Yeah.
touches the area within 2 weeks. Do you still have a way to resolve it, or there's no way to like resolve it or fix it anymore? Like, have you had that experience in the past?
Not really, because every patient can deal with that. Just touch is okay.
How will the follow-up process
Mhm.
work? Let's say they're already in their home country and they have questions or concerns.
Mhm.
How can they contact, or who they need to contact?
They can contact us in many channels, in Line, Messenger, WhatsApp, that's fine. And then if the patients can come only one time, that's okay. But in some patients that can come back about 2 or 3 weeks after surgery, that's great. We will clean the scalp for him and recheck again.
Why do you think, um, again, your country is now being popular for hair transplant?
Thailand is globally recognized for its high standards in healthcare, especially combined with cost-effective treatment for hair transplantation. In particular, we offer internationally certified surgeons, modern upgrade technique, and personalized care at a fraction of the cost in Western countries. Moreover, the country for hospitality and post-operative wellness options such as Thai herbal therapy and resort for recovery make the entire experience comfortable and holistic.
Very well said, Doc. When is really the best time to go to Thailand for like a hair transplant?
We can schedule surgery at any time throughout the year because Thailand is a year-round destination. As you know, you can choose your vacation spot and continue your trip throughout the season.
So there's no good or bad
Yes.
timing. They can go anytime. How do you provide assistance, for example, for transportation when the patient is
Mhm.
already in Thailand? How will you assist them?
Our clinic is near the main international airport, the Suvarnabhumi airport, approximately about 20 minutes from Suvarnabhumi airport by taxi or by the car.
From which countries or from which regions do your
Oh.
patients mostly come from?
We have many countries such as in Europe, in Southeast Asia, South Asia, Australia, United States, Canada, and many countries in Europe, especially among LGBTQ plus individually seeking personalized gender affirming hairline reconstruction.
Now, aside from you who speaks good English, does the other staff also, I believe I'm not, of course, can speak a good English?
We have some staff that can communicate with English.
Now, next question, if you have any suggestions or recommendations for tourist spots in Bangkok
Yeah.
for patients during their stay, what are your recommendations?
It depends on the patient's willing. They're willing to go to the beach or go to the shopping center, going to the mountain. If they want to go to the beach, Chonburi or Pattaya is not far from here, about 1 or 2 hours from our clinic.
Perfect. And any food you would like them to try?
They can try any foods in here.
Yes, I've actually Googled, and I believe some of the street foods in Thailand really looks amazing. Like,
Yeah.
I want to try everything and just be in the market and then just pick all the street foods. Excellent. Well, final
24 hours.
yes, they're 24 hours open, and it's like wow. I will forget the beach and the other tourist spots. I'll just eat all the food. It looks so
That's
good.
good.
My next question might be personal, but I'm also curious. What drew you to the field of hair transplantation or hair
Oh,
restoration?
yeah. I used to be an ophthalmologist, the eye doctor, who performed microsurgery like the cataract surgery over 7,000 eyes. I like small and detailed surgeries, so it was easy for me to move into the hair transplantation. And the hair restoration is a beautiful intersection of microsurgery, anatomy, and psychology. The emotional impact of helping a patient regain confidence through restoring their hairline is immeasurable. I was drawn into this field, this specialty field, because it combines precision with profound meaning.
Excellent. And yes, you have to be good with your hands, like you're talented, but being an ophthalmologist, I think that's way more complicated. But
Yeah,
but
very fine. Yeah.
yes, so I'm glad you have it in you, Doc, and the passion to help others see their smiles after their transformation. I know that gives you the happiness too that, oh, I transformed this patient's life. I'm also curious, if you're not wearing your lab gown or if you're not doing surgeries, what keeps you busy?
Play football and badminton.
So you're into sports.
Yeah,
Wonderful. So are you joining tournaments, Doc, or it's just for fun? Like it's just a
yeah,
normal
just
sport?
for fun. Yeah.
Okay.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.